Hello. So, a patient of mine just like 3 days back got the tooth extracted and is now suffering from a lot of pain. We just now got it treated and I thought that you all should know about it. That why did that pain arise suddenly after 3 days? Actually, the treatment of tooth removal was done because the tooth was not able to save and the patient was having a lot of pain. So, the result should be the pain should have gone. But that did not happen. Sadly, the patient was suffering or having more pain. So come, today let us discuss on this topic of why there is pain even after removal of the tooth.
Subscribe to my channel Dr. Mansi Shah for oral health videos.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, I am a dentist and dental emergencies do arise anytime. May it be day or may it be night. So today's case was a little different, where once in a blue moon this does happen, that the tooth extraction when it is difficult, or the tooth removal when it is a little difficult, what happens is that the patient suffers a little more pain, and there are chances that you might get a condition called as dry socket or what is called as alveolar osteitis. So what is this and why should we know about it? So make sure, so the first and the most important thing that you should know is, after you get your tooth removed, a little bit of pain is very much common. Yes, you might have pain in the jaws or the pressure pain that you might feel, but you should be able to combat it with the help of painkillers and antibiotics. But if it is not working, the pain is increasing day by day, and you can see an empty socket kind of thing, the empty hole which is not getting filled or not getting healed, then you must definitely visit your dentist promptly, because this is the condition where the tooth which has come out is definitely leaving a hole behind. That hole or that socket should get filled up within few hours of your surgery with the blood. Then there should be a clot formation and the wound there should heal completely. This complete healing process might take 7 to 21 days. But in this healing process, there should be no pain that you should feel. So friends, if you are having pain, means what has happened is the blood clot that should form is not formed there. It has got dissolved or it has got dislodged. Now, what is the cause that it does not happen? It can be some difficult extraction, and this kind of difficult extractions are seen especially in the wisdom teeth, or whenever there is some root piece which was or some very badly grossly decayed tooth. This kind of difficult extractions, the dry socket can happen, or if there is some bacteria that have invaded the area of healing before the healing process starts, right? So this is the cause why these dry sockets happen. Now, what can you do at home to treat this dry socket is take painkillers. But if you visit a dentist, what is expected? What will they do? So they will place a medication, give a good dressing of a gel or a medication there, which will soothe down your pain. Within 1 hour you should feel the relief, and post that the healing process is initiated. And the dressing is then, the doctor might call you to change the dressing, or the dressing will fall off on its own when the healing is started. Now, why is there this blood clot formation an important process? What happens is this blood clot, it covers all the nerves and the bones which are there below the tooth which was extracted. So it is covering it and the pain won't trigger up. But if this blood clot is not formed, the bone and the nerves below get exposed. That is the reason why you are getting this triggering severe pain. Once this medication and dressing is placed, the dentist has promoted healing there, the pain should subside. Now, how can you distinguish between the healing is happening or it is a dry socket that is forming? So in the case of healing, the blood, the upper mass that you will see is usually red or a little bit whitish depending on the healing site, and that area should fill up with gums within 7 to 10 days. If there is dry socket form, you will have the symptoms like pain. There may be bad taste in your mouth because there is some kind of infection. There may be bad breath also because that area is not healing, it is giving some kind of odor out. This is the symptoms that you are suffering from, and how the site will look, it will look greyish, or there will be food lodgement, lot of food lodgement that is taking place. So whatever food that you are eating, if that is seen in the socket, then yes, the socket is not healing properly. What is to be done to maintain or prevent dry socket formation is follow all the instructions which are to be followed after a tooth extraction. If you want to rebrush that or revisit the instructions, this is the link. Make sure that you visit it and follow all the instructions which are required for a complete post-surgery care. And if that care is to be after that care, make sure that you after 24 hours make sure that you rinse your mouth properly with warm salt water or chlorhexidine mouthwash, some betadine mouthwash, so that this kind of dry sockets or infections don't occur. So this was a video on treating of dry sockets and how can you deal with it. It is very much important that you visit your dentist and get it treated, and it is a very small procedure which is to be done and you won't take much time, but going and visiting your dentist is going to save you from a lot of pain and get a good relief and good healing in that area. Hello friends, I am Dr. Mansi Shah, practicing in the city of Pune. This is my mail ID. If you are interested in an online consultation, we can definitely schedule it, and feel free to mail me up here if you have any concerns. If you have any dental related questions which you want me to answer and also want others to know about it, mention it in the comment section below. I'll definitely make a video on it. Do not forget to like, comment, share this video among your friends. Subscribe to my channel Dr. Mansi Shah. Wishing you all a pain-free, healthy and a very happy smile. Stay healthy, stay happy, stay aura fit. Thank you.